January being the Cervical Cancer Awareness Month, I decided to dwell more on the disease to knock off all there is to know about it. Welcome to Talking Health with Bumi, and thanks for joining me. Last week, I briefly discussed what cervical cancer is, but today, we're going to delve a bit deeper into the issue with a doctor in the studio with me to extensively explain this and possibly clear all your nagging queries. It may interest you to know that cervical cancer is the fourth most common cancer in women, with 604,000 new cases in 2020 alone, according to the World Health Organization. So, what in actual fact, you will ask, is cervical cancer? How does it grow? Who does it affect? These and many more in a bit. Stay with us. Thanks for staying tuned. Dr. Adara Enyi is an oncologist. She is a co-founder and the chief operating officer at Oncopadi Technologies Limited. Oncopadi is a digital health innovation company that empowers confident cancer care decisions by patients, clinicians, and healthcare companies. Welcome, doctor, and thanks for joining us.
Thank you for having me on the show today.
Doctor, a lot of things on my mind. I'm trying to see where to start from. But really, doctor, tell us, what causes cervical cancer? Before I go into that, what actually is cervical cancer?
So cervical cancer, just as the name implies, is cancer of the cervix. Now, what you must know is that the cervix is an organ found in women or in genders that are associated with the female gender. So the cervix is an organ found in females or in women. And so cancer of that particular organ called the cervix is what is called cervical cancer.
So what are the causes of cervical cancer?
So unlike so many other cancers that we don't know the cause, I'm happy to say that cervical cancer is one of the few cancers that has a known cause, right? Unlike all the other cancers. Breast cancer, we don't know the cause. Colorectal, we don't know the cause. But in the case of cervical cancer, we know and we can identify its known cause. Now, cervical cancer is caused by the persistent infection of the human papilloma virus, or what we call the HPV. And this HPV is usually sexually transmitted. So HPV causes cervical cancer. So the HPV gets into the cervix and actually disrupts the cells of the cervix that leads to cervical cancer.
Okay, it's as if the HPV virus is just getting popular. Come on. Yeah. When I was younger, I never heard of HPV. Yeah. When was this discovered, doctor?
So I can't exactly date back to the time when it was discovered, but more recently, what is happening is that there's now more information about the human papilloma virus. Okay. And what is great to note is that HPV as a virus not only causes cervical cancer, in fact, HPV has over 52 strains, right? So we have from strain 1 to about almost 52 types of strain. But the particular strain that causes cervical cancer is the strain 16 and 18, all the strains 6 and 11. So in terms of cervical cancer, we're looking at strains 16 and 18. And so those strains 16 and 18 are what we call the high-risk HPV strains, and those are what lead to cervical cancer. HPV strains, other strains like 6 and 11 can cause things like genital warts or even oral cancers or other types of cancers, but particularly the strain 16 and 18 causes cervical cancer.
I see. I know that there is heightened awareness about the HPV virus these days. Now, what are the early signs, and symptoms of cervical cancer that women should be aware of?
So one of the earliest signs and symptoms of cervical cancer will be bleeding, right? So women, when you have abnormal bleeding, right, from the cervix, more or less more visible on, your undies or something, right? That is an indication. You may also have painful sexual intercourse that can also, lead you to cervical cancer. But of course, by the time you're already experiencing pain, right, then many times it has gone from precancerous to more what we call cervical cancer. So a little backstory, or for clarity for those who don't know.
Okay.
Cervical cancer, unlike other types of cancer, starts really slowly, right? So it starts as what we call the precancerous lesion. And we have the precancerous lesion, or CIN1 to 3. So it starts as CIN1, progress to CIN2, and progress to CIN3. And so it starts really gradually. When it becomes cervical cancer, full-blown cervical cancer, many of the symptoms are now super evident.
Okay, sorry, doctor. When you say CIN
Yes.
1, 2, 3,
Yes.
how long does it take to get to all those stages? How long? 1, 2, 3, 10 years?
Usually, there's no time stamp to how long it takes. It really differs from persons to persons. But typically, you would say that once you do your routine screening, at whatever stage we're able to pick it out, particularly in the precancerous lesion, we can treat. When it crosses over to a full-blown cancer, then we can no longer treat.
Okay, now you did talk about, blood stains.
Blood. Bloody
Now
discharge.
I need clarity in that, because sometimes with women with irregular menstruations, they could see blood. Some people even spot. So how do you know that this is what is happening and it is not the other? How are you sure? By yourself.
Yeah, so when you are bleeding outside of your normal menstrual period, so take for instance, I like to say that the woman's cycle has about 4 stages. So you have the menstrual, right? Then you have the luteal phase. Then you have the follicular or the ovulation phase, right? And then the cycle returns back again to the menstrual phase, right? So typically when you're bleeding anytime outside of your menstrual cycle, right, then you definitely, is a cause for alarm. Why should you be bleeding, outside of your menstrual cycle? Why should you be having pain when having sexual intercourse? Most times, cervical cancer risk factors is more prevalent in women older than the age of 40, women approaching, menopause. So from 40 to 50, there's a higher incidence of cervical cancer. And so if you're already menopausal, meaning you've stopped menstruating, and then you begin to start seeing bleeding, then it's a cause for alarm.
So when you say cervical cancer is more predominant in women from like age 40
and above, yes.
Why is there awareness, heightened campaign for students, even a lower school, to get
the vaccine?
So,
just like as I said earlier, unlike other types of cancers, cervical cancer is slow progressing. So it takes years. It takes really time. And what we found that, like in the Gardasil vaccine that actually helps to prevent, one of the HPV vaccines that actually helps to prevent cervical cancer, can be taken very early and has a very because the idea is you want to protect that woman before she enters a very reproductive or a sexually active phase of her life, which is the phase at which she can actually contact HPV, the HPV virus. And so you want to take it very early for young girls or young women so that you protect them as they're approaching, that age where they become sexually active. And so when you're able to give them that early, you're able to protect them for as long as 10 to 15 years from the time they become sexually active. Okay, and so that's why we give it that very young. Okay. Remember, as I said, that HPV is not only causes cervical cancer, it also causes all other types of cancers, genital warts, and a few other types of illnesses.
Oh, okay. So what are the common risk factors associated? Before I ask that question, okay, something came to mind as you were explaining, and that is the HPV vaccine. Is it once in a lifetime, or does it have time? Does it expire? That you have to renew it, kind of. How does it work?
So depending on the type of vaccine you take, be it Gardasil or Cervarix, more popularly, Gardasil is taken in places like in America, while Cervarix is used in places like Europe and also in places like Africa. So depending on the type of vaccine you take, you may either need to take 2 doses or 3 doses, depending on the type of vaccine, and it will be stated in the vaccine. But typically, when you take the vaccine, you have coverage for as long as up to 15 years.
I see.
Right? And then many times when you have crossed, so if you've taken the vaccine when you are young, or you've taken the vaccine, say, maybe when you are 15, right, you have coverage all the way to when you are 30 before you become, even sexually active. So you are actually covered. There are also booster doses that you can actually take for HPV. But the most important thing is that once you've taken that vaccine once, many times, it does a lot in terms of covering you. Some studies have even said that it covers as much as 30 years of the woman's reproductive or sexually active lifetime.
I see. Thanks for clearing the hair on that. That's quite a mouthful.
Yeah.
We'll take a quick break now. Please stay tuned. Thanks for staying tuned and welcome back. Now, doctor, what are the common risks associated with the development of cervical cancer?
I always love these questions because risk factors are very, very important, and it's something that people always underestimate in cancers. Now, risk factors typically are things that we've studied. After studying for hundreds of years, we found to be associated with that particular type of cancer. And now in the case of cervical cancer, number one, of course, you have to be a woman. You have to have a cervix. And only, as we said, only women have cervixes. So for you to have cervical cancer, you have to have a cervix and you have to be a woman. So that's your first risk factor. The second risk factor is cervical cancer is more predominant in increasing age. So that means if your next birthday is your 40th birthday, or if you are above 40 going towards 50, you are at a higher risk than someone younger, right? The second thing is because we've said that cervical cancer is caused by the human papilloma virus. So anything that allows you to contact to get the human papilloma virus into your body would actually increase your risk. So number one, increase sexual intercourse. By virtue that you are open to sexual intercourse, you are at risk of having cervical cancer. Next is also not taking the vaccine, because the vaccine is supposed to protect you from having cervical cancer. So if you do not take the vaccine, then you are at risk of cervical cancer. Then next is having too many sexual partners. So multiple sexual partners would actually increase your risk of cervical cancer. Also, it has also been noted that smoking, people who smoke also take in toxins that actually damage the cervical cells, the cells of the cervix, and that can increase your risk of cervical cancer. Then you also want to look at use of oral contraceptives. Frequent use or overuse of oral contraceptives also increases your risk of cervical cancer. Then a weakened immune system, right? So people or women who have things like HIV or anything that weakens their immune system, right? Because the idea is if a virus comes into your body typically has an immune response, builds an immune response to that virus that has come in to actually remove or, kill off or flush out, as the word implies, of that virus. But in this case, because you already have HIV, your immune system is weakened, and so your body is not able to build or mount a response to the human papilloma virus once you get infected with it. So, so weakened immune system. And I think lastly will be a family history. If you have a family history of cancers, you most likely are at risk of, developing that, especially for the DNA type of human papilloma virus.
Oh, there is a DNA type.
Oh, yes, there is.
Oh, I see. So what are the available treatment options for this disease? How do they vary depending on the stage of the disease?
So when we talk about treatment, we always like to start treatment from primary to secondary. So primary will always entail screening, and that's why and this month being January is Cervical Cancer Awareness Month. And so we are preaching that all women, once you know that you're a woman, you are sexually active, it's very, very important, firstly, that you start from the prevention, which is getting a regular cervical health check. And you can do this by doing a simple pap smear, right?
Please, can you explain this pap smear?
So pap smear typically means going into the facility, a speculum is passed, we put in a brush, right? And we actually swab the entrance of the cervix, put it on a smear to actually check those cells to see what type of cells are present. If the cells, are, in their precancerous stages, or if they've become full-blown cancers. And that's what typically a pap smear is. So a pap smear is done, by taking a smear out of your cervix, putting it on a microscope and actually monitoring, watching the cells under a microscope. Right, so that's a pap smear typically. And if there is any changes or notable changes that are noted, those are noted for you, and then action can be taken almost immediately. For mothers who have young girls that have clocked the age of 9, another preventive way is making sure that your girls are vaccinated. Right? If you're a young girl, or if you're not yet even sexually active, it's important, irrespective of the age.
From what age do you recommend?
So we always recommend that from the age of 9,
okay,
as long as you're not yet sexually active, please go ahead and get an human papilloma virus vaccine. So get the HPV vaccine.
And for those who are already sexually active?
And for those who are sexually active, we always preach the co-testing, right? So if you're already sexually active, please do an HPV DNA testing, right, together with a pap smear, and then you can get the HPV vaccine. And so so we've talked about primary treatment, and so we'll talk about secondary treatment. So secondary treatment usually involves, once you've done a pap smear and your pap smear is positive for any of the precancerous lesion, right, we do what we call a colposcopy. So a colposcopy means us going in there and actually firing at those cancer cells, right, and trying those precancerous cells rather, and trying to kill them and remove them. Of course, the other type of treatment will be, once it's become full-blown cervical cancer, right, you either want to enroll for chemotherapy or some form of radiotherapy as a palliative treatment. But of course, we don't want it to get to that. So many times, we always want you to do your regular routine women's health check by doing a pap smear, or by doing a cold testing, which involves an HPV DNA testing and a pap smear, but making sure that you also have the vaccine irrespective of what age you are, as long as you're above the age of 9.
Okay, so how often should women undergo this cervical cancer test?
So for a woman, it's important that at least once every year you do a pap smear. If you can't do a pap smear every year, at least do it once every 2 years, right, for a pap smear. Especially if the first pap smear you've done is negative, then you can do it in the next 2 years. For those that can afford to do the co-testing, which is the HPV DNA testing and the pap smear, then you can do this once every 5 years. So you can see that it's not really that frequent. So you actually have enough time to plan for it. So if you do a co-testing, now what happens is that the HPV DNA testing is more specific, because it will actually pick the exact strain, right? So it goes all the way down to the DNA level, right? And so that's why it's only needed to be done once every 5 years.
Okay, like we always say, prevention is better than cure.
Exactly.
So what kind of lifestyle, particularly for those who are still young, so that they can prevent themselves, what kind of lifestyle would you recommend that, can, if they go beyond or outside of, can have negative impacts, on...
So we would always preach, and we practice the same, what we preach. Firstly, we always advise, please, 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 if you must have sexual intercourse, use protection, right? Avoid having sexual intercourse with multiple...
But part of the protection, doctor, is oral contraceptive. And we're now
so part of the protection is actually using like a condom or any form of barrier method. Either you use the female or the male condom, right? But if you must have sexual intercourse, most importantly is that you actually have just one sexual partner, right? You don't have multiple sexual partner. Secondly is, we always preach the ABC. So it's abstinence first. If you can't abstain, then you must do your regular checks, right? So you must do your regular checks, right? Make sure that you have one sexual partner. Make sure that every year you at least getting a pap smear test done. or every 5 years, you're doing an HPV DNA testing with a pap smear, which is a co-testing.
Okay.
Next is you want to avoid smoking. And when we talk about smoking, we talk about smoking in all its forms, right? Because actually the toxins emitted from smoking actually destroys the cervical cells, right? And so that's what actually predisposes you to actually contacting the virus. Next is also you want to ensure that your viral status is known. So you want to prevent anything that will allow you from weakening your immune system, right? Anything that will make you actually get HIV. Next is you also want to know that if you already have a family history of cancers, you want to do well enough, to protect yourself by getting the vaccine early, right? And also monitoring your health as you go along, right? Also is that you want to make sure that if you're a woman, there's not much you can do, but you want to eat right, exercise right, and on a day-to-day basis, make sure that you avoid environments or dirty environments that are actually predispose you to contacting such viruses. And I think if you do all of this, yes, you should be able to have or achieve a healthy lifestyle despite the, widespread availability of the human papillomavirus.
Wow, that's wonderful. That's really incisive. A word, they say, is enough for the wise.
Yeah.
If you love life, live healthy.
Yeah.
Thank you so much, Dr. Adara, for having you in the studio with us today.
That's
for your for the invaluable time you have spent with us. So that's all we can take on the show today. Hope you have gained lots, as I have. So until next time I come your way again, think health matters. Think Talking Health with Bumi. Bye for now.